First one up is Dr. Charles Zeanah from Tulane University School of Medicine. Dr. Zeanah, are you on, sir?
Yes, I am. Can you hear me okay?
You're coming in loud and clear, and go ahead with your testimony.
Thank you, Mr. Chair. My name is Charles Zeanah. I'm a professor of Psychiatry and Pediatrics at the Tulane University School of Medicine in New Orleans. I've been board certified in psychiatry and child and adolescent psychiatry for more than 40 years. For the past 3 decades, I've directed a community-based intervention program for maltreated children. Our team has evaluated and overseen the treatment of more than 1,500 children in foster care, more than half of whom were less than 6 years of age. I've also conducted research on children who've experienced severe trauma and/or severe deprivation in the United States and in other countries, especially interventions designed to promote their recovery. I've consulted nationally on cases involving decisions about placement disruptions. I was also involved in helping Louisiana's Department of Children and Family Services craft policies, and later consulted about legislation in Louisiana that is quite similar to Senate Bill 181. Though I first became involved with maltreated children because of the well-established links between experiences of maltreatment and later psychiatric problems, I've come to realize that decisions made by child welfare agencies and the courts often have even more powerful effects on children's outcomes, for good and not so good. Based on my many years of experience as a clinician and an investigator and my reading of the scientific literature, I can assure you that Senate Bill 181 is well grounded in developmental science and represents a significant step to assure young children's well-being is protected. Senate Bill 181 will create greater stability for children in foster care, first by improving searches for family member placements and giving the Office of Children's Services in the Alaska court system more latitude to make placement decisions in the child's best interest. The bill also provides guidance in situations in which foster children have been with foster families for long periods of time before being removed to be placed with a family member. Biological family connections are important, but increasingly we've come to appreciate the central importance of relationship stability for children and the psychological family that the child experiences. I'm very pleased that the proposed legislation emphasizes that when a child comes into care, a thorough relative search should be prioritized and completed as soon as possible. This makes it clear that the purpose of this legislation is not to oppose kin placements, since the initial task is to identify suitable kin caregivers, but rather to acknowledge that stability is extraordinarily important to the well-being of young children. Having them placed with kin caregivers as quickly as possible promotes family connections and stability. I understand that the bill adds new requirements to state law that when conducting searches for adult family members and family friends, and a 30-day deadline for the initial search to be better ensure more thorough and timely searches. This urgency is well-founded. Considerable research has shown that disrupting placements, which means disrupting relationships, is harmful to young children who have established healthy attachments to their caregivers. The number of placement disruptions a child experiences increases risk for serious psychological, social, and cognitive problems. That this bill is designed to prevent unnecessary disruptions is laudable. Children are placed in foster care because they cannot be safely maintained in their homes. After experiencing a stable placement for more than 6 months and developing a healthy attachment to their foster parents, the risk of disrupting this attachment increases the risk to the child. The risk is even greater if the disruption occurs after 12 months of a stable placement. My research team conducted a study of young children who suffered severe neglect in infancy and showed that even one disrupted placement of children in foster care substantially increases that child's risk for a diagnosable psychiatric disorder years later in adolescence. Because of this, moves to anyone other than biological parents should happen only if the court finds that the move is clearly in the child's best interest. In summary, this bill represents an opportunity to do what is best for some of Alaska's youngest and most vulnerable citizens. I offer my complete support. Thank you very much, and I'm happy to answer questions.